In this video, we will go over common zoonotic diseases of poultry. The first one we will talk about is Campylobacter. Campylobacter is a bacterial disease that is most common in summer and fall. Campy is found in the lower intestinal tract of poultry, and people who would be more at risk for Campy are those who are working with the animals and those who have contact with poultry. This disease is transferred through fecal-oral route. So when you come in contact with contaminated feces or contaminated surfaces, and you do not wash your hands before eating or touching your face, you may have the potential to infect yourself with Campylobacter. Symptoms in humans can include diarrhea, fever, and abdominal pains. Poultry will largely be asymptomatic and not show signs of disease. Treatment for Campylobacter includes antibiotics that are prescribed by a veterinarian or physician. The next common poultry disease is Salmonella. This disease is most commonly thought of in undercooked foods, but it can be passed through fecal-oral route in live animals. Salmonella is caused by bacteria in the poultry's intestines, and symptoms for Salmonella can begin in as little as 6 hours to 6 days after ingestion of bacteria. People who are most at risk for Salmonella are children who are less than 5, people over the age of 65, pregnant people, and those who are immunocompromised. Symptoms in humans can be fever or abdominal cramps. Poultry may not show symptoms of Salmonella, but young poultry are more likely to show symptoms of Salmonella and may show signs of weakness, loss of appetite, and poor growth. Treatment for Salmonella includes antibiotics. The last common poultry disease we will talk about is avian influenza. Avian influenza is caused by type A flu. This is mostly spread in wild birds, who will then infect domestic poultry. Avian influenza will not normally infect humans, but it can occur in some situations, and something people should be aware of. Avian influenza is also a notifiable disease within USDA, which means that once there is a positive case, then your veterinarian must report it to the USDA. This is spread through close contact and infected surfaces. People who will be at most risk for avian influenza are those who work with poultry, and symptoms in humans can look similar to human flu. Symptoms in poultry may be decreased egg production and high death rates in the flock. To treat avian influenza in humans, then your physician can prescribe an antiviral drug. Animal treatment will be depopulation to reduce any further spread. Another way to prevent avian influenza is to make sure that everyone on your farm knows what to look for. This way you can catch early warning signs and make sure that you are properly isolating the sick animals from the healthy ones. If you have any questions or concerns about common poultry diseases, please contact your local extension office or your local veterinarian.